Good evening, and thank you so much for joining us for this special The Rebound Colorado Town Hall. I'm Elizabeth Watts. I'm joined this evening by anchor Anne Trujillo from our station in Denver, Denver 7.
And good evening, Elizabeth, and thank you to everyone joining us across the state of Colorado. We asked all of you to email us, call us, and join us on video conferencing to talk about the issues we all face as we get back to work and try to make ends meet.
And this evening's town hall will feature Governor Jared Polis. We'll also speak with the executive director of the Colorado Department of Labor and Employment, Joe Barella, and Dr. Rachel Herlihy, the state's epidemiologist.
And Governor Polis, thank you for taking the time to answer the questions of Coloradans across our state. And we want to start with where things stand in Colorado right now. How do you feel Coloradans have responded to your stay-at-home and safer-at-home orders? Are you at all concerned about another spike in cases? And if that should happen, would you even consider another stay-at-home order?
Well, first of all, we've lost over 900 Coloradans have succumbed and lost their lives due to this deadly virus. So it's certainly not a time to celebrate with that kind of loss amongst us, everyone, a sister, a brother, a mother, a father, a son or daughter. But at the same time, we know that it would be a lot worse, if Coloradans hadn't succeeded in staying at home and are now acting with full responsibility and individual responsibility and being safe. And that means as they venture back out, as we say, safer at home, Coloradans are still staying at home when they can and trying to remain at least 6 feet from others when they are interacting with others, and wearing masks when in public and in stores. And it's so important to make sure that we continue to do everything we can to make Colorado as safe as possible.
And Governor, how is the state preparing for a possible rise in cases this fall and winter?
Nobody knows what the winter will bring. We don't yet know the full impact of weather on the virus. We know that it doesn't survive outdoors in direct sunlight and heat, but that's not the main mode of transition. It's mostly person to person, and that's why we want to make sure Coloradans are prepared to maintain this kind of social distancing and mask wearing for the next few weeks and months. This is going to be the way that we get by and don't have to give up the things we love, whether it's shopping or outdoor recreation. All those things depend on how successful we are at staying apart and wearing masks in public to make sure that we can prevent additional spikes in the death rate and hospitalization.
And many Coloradans want to know how this will continue to affect education for our kids. Do you anticipate that students will be back in classrooms this fall? What about colleges? What about sports?
I do anticipate that kids will be back on campus in August or September. And it's not going to look exactly like it has in the past. When we're working closely with superintendents and school districts to make sure that they have the guidance to do increased social distancing. We're able to learn from countries like Denmark, which the kids have already gone back to school. We'll have a good sense of what works and what doesn't work from similar efforts across the world to make sure that this virus doesn't interfere with the learning of our children.
We know specifics on the state budget are still to come. How are you going to address more cuts and loss of revenue to our already underfunded school systems?
Well, look, this is a tough time, not just from a health perspective, but it's a tough time economically. I know many families are making sacrifices. Some two-income families have lost income. Others have lost their jobs. So it's completely appropriate that just as families are tightening their belt, the public sector, the state, your cities, your counties are also tightening their belt. This is a tough time. We're going to prioritize and make sure that the most important things continue to be funded. That certainly includes education, one of the most important things that the state does. But this is going to be a difficult time, not just for the private sector and individuals, but certainly belt tightening for the state as well.
And several of our viewers reached out with questions about wearing masks in public. The first question comes from Jane in Aurora, and she left us a voicemail about enforcement. Take a listen.
Hi, this is Jane from Aurora. I have a question about the order for wearing masks. I noticed in the stores I was in, Walmart, there were hardly any customers wearing a mask. I'm wondering why the store itself can't enforce that before they let them go in. Thank you.
All right, so we know several cities, including here in the metro, have made masks mandatory. Is that something you ever consider doing at the state level? And Why not just make it easier on everyone and provide masks to all Coloradans?
So first of all, stores can and in fact should enforce that today. You know, it used to be that stores would have signs up that said no shirt, no shoes, no service. We absolutely are very supportive of stores that want to say no shirt, no shoes, no mask, no service. And the individual stores wanting to protect their employees should do that. Another step we've taken as a state is all of the people that work at the store, the retail employees, they are required under law to wear masks when they're interacting with the general public, and also gloves when they're handling the goods and services that go on the shelves. So that should be occurring as well. A number of municipalities have ordered that all customers wear masks. It's important that those local orders are followed, right? Just as the state has the legal authority to make laws and do executive orders, so do your county and municipal governments. So we want to encourage it regardless of whether it's required in your area or not. It's smart, it's common sense, and it protects yourselves and your loved ones to wear a mask when you're in public. You can find out more at coloradomaskproject.com, which has instructions about making masks. You don't have to buy them. This is not an economic burden on anybody. An old t-shirt, a scarf, any of those suffice. Just needs to cover your nose and your mouth and obviously not get in the way of your breathing, and it'll work to reduce the spread and the infection rate.
Did you ever consider making it mandatory for the entire state?
Well, we did make it mandatory for the workers at the stores to wear masks when they're interacting with the public. We have a number of ways that we can enforce that. When you're talking about enforcement of mask wearing in general in public areas or among customers, you need to have municipal partners that want to enforce that. There's not, state troopers in stores or in urban areas that are doing that. If a community wants to do that, you should follow the rules of your community. But don't wait for your community to pass that law or pass that rule. It's the smart thing to do. It's common sense. Wear a mask when you're around others. The life you save could even be your own.
All right, and Governor, we also heard from viewers on the other side of the mask debate. Dave writes in, asking why you're still suggesting that we wear masks. He says cloth masks do nothing to stop the virus, and even the World Health Organization has suggested wearing a mask can actually make you more susceptible to getting infected. So can you explain to us why you wear a mask and encourage us all to do the same once again, especially if a vaccine is still a year away?
Wearing a mask has a significant impact on reducing the spread of the virus. It really does three things. One, if you're infected and don't know it, it prevents infection of others by containing some of the contagions through your coughs and through your sneezes. Secondly, if others have it, it prevents those large droplets from entering your nose or mouth. And perhaps most importantly, it prevents you from infecting yourself after you touch a contaminated surface or your hands encounter the virus, because unconsciously we touch our hands or our nose upwards of a dozen times an hour. If you have a facial mask in place, you're far less likely to contaminate yourself through your nose and mouth. So it's very important, but that masks alone don't make the difference. They're not a substitute for social distancing. If you're 2 feet away from somebody who's infected, are you safer with a mask? Yes. Are you safe? No. That's why we still want people to stay 6 feet away. The combination of 6 feet away with facial masks significantly reduces your infection rate.
And Governor Polis, the stay-at-home order we know has kept families apart because of the virus. Viewer Schotzing joined us on a recent Zoom conversation asking about the state plan to protect our elders and those especially in our senior care facilities. She misses seeing her mom. She also wants to know she is safe. You yourself have told us your own children have not seen their grandparents. So when can our families get back together and safely?
You know, this virus is far more deadly for people in their 70s and 80s. People in their 30s and 40s, most are going to make it through. It still has a very high fatality rate, as high as 1% for perfectly healthy people of different ages. But when you're talking about folks in the 70s and 80s, it can be 10%, 15%, even 20% of perfectly healthy 78-year-olds that this can take down before their time. And I know we all want to see our parents, our grandparents, you know, my 5 and 8-year-olds certainly want to see theirs. But you know what we want even more, and my parents are 76. I want to make sure that my parents are there for years and hopefully decades to come so they can see my kids graduate, see them hopefully start their own families. And you don't want to put that at risk by trying to see them too soon during the month of May. We want to have them with us for many months and years to come. And that's why it's particularly important that people over 65 stay at home and avoid social interactions, including with their grandkids and extended families, so that they all join together over the many months and years that we all have ahead of us.
And hundreds of thousands of Coloradans have filed for unemployment, as we know, many struggling to pay rent right now. Your office called for the suspension of all evictions, but we've heard from landlords who are affected by that decision. Listen to this question and then please share your response for us.
Yeah, I have a question. I'm a small-time landlord, and Polis says that I can't evict. How long is this going to go on? Because I'm going bankrupt. I'm losing about $3,000 a month because my tenants just will not pay now, since they said that they don't have to. And I would like to know just how long I have to carry my tenants. They just quit paying. Thank you.
Well, it sounds like that landlord has a bad relationship with their tenants because every tenant has to pay their rent. There's no excuse not to. What the courts that normally process eviction orders were unable to process eviction orders in April and May. They're at limited capacity, like much of the rest of society. They're doing the necessary work in our court system. Criminal charges have to be done on a prompt basis, but they are deferring civil actions like eviction notices until June. So if people are paying their rent, they will, of course, continue to live there. If they've lost their job, what some landlords are doing is they're amortizing their April or May rent over the course of the lease, the additional 12 months. But obviously, if they don't pay their rent, they'll be evicted as soon as the courts are functional. So the laws are all still in place. It's just the courts have limited capacity to really do that work on the eviction and the civil law side because they, too, are worried about people who work in the courts and the judges and everybody else being safe.
Is there any help for these landlords in this kind of situation, or you're just suggesting that they wait until the offices open back up, able to push those through?
Yeah, the only economic piece of what's happening, every dollar in rent that is owed needs to be paid, but there's no penalties or late fees. So that's all that's being waived are the penalties and late fees for folks who, have lost their jobs or out of work and otherwise might be evicted sooner rather than later. They will have that opportunity to make their rent whole, including their April and May rent, without late fees as soon as they can.
We have heard from several brides who want to know if their weddings this summer will go on as planned. Sally emailed us saying, I would like to know if gatherings like weddings with 150 guests will be allowed in June. Andrea also emailed us, as we reopen Colorado, I'm wondering when we can expect to have groups larger than 50. With an August wedding date, should we be planning or postponing? Will weddings and religious services be allowed this summer? And if so, would you go to one?
A lot of people are asking that question, who planned on getting married in June or July or August. First of all, I would encourage people facing that to not let this public health crisis get in the way of your plans, meaning the religious piece associated with marriage, the civil piece, those are occurring now. In fact, we even did an emergency rule to allow marriage to occur remotely, but you can do that even with a priest or a rabbi. You can go down and get your civil papers. What has to wait is the large public celebration, right? In May and very likely in June, there's not going to be groups of 100 or 200 or 300 because you could be jeopardizing the lives of those who mean the most to you during a special time in your life. Don't let that get in the way of the religious and civil rights associated with marriage. But in terms of when you can schedule a large celebration with your extended family and friends, we don't yet have the date that you can do that without putting those family and friends at risk.
Well, let's talk about some of those because we have so many summer festivals, fall festivals in Colorado. When do you see those happening? When do you anticipate seeing fans in the stands for a Broncos game, perhaps, or at CU, CSU, or an Air Force Academy?
All of those teams are figuring out their plans. Major League Baseball, I'm a big baseball fan. They have obviously delayed their season. We're going to accommodate them however we can in Colorado when they're ready to play. We're going to work with all the college sports teams. If they're ready to play, we want them to play. Now, what the Major League Baseball is looking at is they might play to empty stadiums. There might be broadcast. There might be diminished capacity at stadiums. All those things are on the table, and we're working with both the team owners, the Broncos, the Rockies, as well as our colleges to make sure that we can continue the proud tradition of athleticism in our state.
Sure, and I'm talking more about some of the other events that, like fall festivals that happen in Colorado. In the fall, let's say September. Is that a reasonable time? That's one of the most perfect times in our state, perfect weather. Do you anticipate gatherings in the fall?
Oh, in September. Well, look, I certainly hope so. You certainly hope so. Coloradans hope so. Americans hope so. And we all want to do that as soon as we can. Really, what's going to determine the safety of large gatherings, outdoors and indoors, is how well we are safer at home in the month of May, continue to the month of June. It's how successful we are at staying 6 feet away from others, how successful we are at wearing masks when we go out. The more that we're able to do that, the better place we'll be in to have larger gatherings in the fall and beyond.
So let's talk about tourism in Colorado. We all know this is a beautiful place to live and to visit. Tourism is an important part of our economy. David emailed us asking, how is the state going to protect those of us who live here from infections and deaths increasing exponentially when tourists start coming into the state later this summer and fall? You know the tourists will come. How will the state address that when we are already seeing our trails closed because of crowds?
Yeah, many of our communities that are home to strong tourism and recreation economies, our high country, as an example, they're not yet ready. They're not yet ready to welcome tourists back to Eagle or Summit County, to Mesa County, to many other areas. That day will come. I think what's very important is that we respect the voice of those who live in those communities, and as well as look at the statewide health conditions. But as soon as those areas feel that they're ready in as safe a way as possible to have that kind of visitation, the state will look forward to working with them to make sure that they're able to do that in as safest way as possible.
What is the thought process then behind closing campgrounds and hiking in open spaces where distancing and space are easy to come by?
Getting outdoors is really important for our health. We were one of the few states that kept our state park system open through this entire health crisis, because you know what? Our state parks are a lot more spacious than municipal parks. People are able to have more social distancing. We want to make sure that we're not encouraging tourism from other states or even from different parts of our own state. Campgrounds are certainly safe from a physical perspective, but we want to make sure they're not drawing people in to infect people that are otherwise in communities that are free of the virus.
And we have to ask, when might you feel comfortable leaving Denver to visit Garden of the Gods, the Royal Gorge, or the Great Sand Dunes? When would you feel safe getting on a plane again with your loved ones?
Well, people are flying every day, including members of our congressional delegation flying commercially back to D.C. to vote on aid packages for Colorado. Yet another way that we respect all those in public service for the risks that they take on, both as first responders, as elected officials, so many that are putting themselves at risk for our state. I think that families should be cautious. It's not a time for anxiety. It's not a time for fear. But just because things are open doesn't mean you want to put yourselves at risk, particularly if grandma or grandpa lives with you, particularly if you have a pre-existing condition. Be smart, be safe. Try to stay 6 feet away from others, reduce your social interactions, and wear masks when you're in public. And we'll get through this as quickly as possible and save as many lives as possible.
Governor Polis, when would you consider a reasonable time then to travel with your family?
Like most Colorado families, we have an 8-year-old and a 5-year-old, my partner and I. We take one walk around the neighborhood with our dog every day. We wear masks, and the kids are doing online learning at home. And of course we go in and go out and quickly do grocery shopping. We're using delivery for that sometimes, and occasionally we're going in and doing that where we can. People should take the precautions that they feel comfortable with. I mean, the more that you're able to take, the safer you'll be. Just limiting those social interactions, knowing that there'll be plenty of time in the future for us to be with our kids and having picnics and going biking with friends and play dates. But we want to make sure that we're all around for those days and the months and years ahead, and don't put that at risk by trying to do too much too soon in May or June.
And Governor, you have acknowledged expanded and mass testing is critical in our state's plans to reopen. Our next caller had a question about where we stand with mass testing and those antibody tests that we're hearing so much about. Take a listen.
I wonder if there's a plan in the works to roll out testing en masse and set it up at different locations. I saw a report in the 5 o'clock hour about the Women's Health Group in Thornton having antibody testing available now, but it flashed so quickly on the screen I didn't get all the information. So I hope to get a repeat of that information and exactly where you go and if just anybody is able to get it. I just feel like it's really critical to know how quickly the people who are immune, for them to know if they can just step out, almost certainly assured that they're not going to get coronavirus and get sick again. So thank you.
So, Governor, what advice do you have for those interested in getting testing?
So the route for most people for testing is through your own doctor. The hospitals do most of it. But we know that not everybody has a doctor, not everybody lives near a hospital. So we've set up 20 free testing sites across the state. And by the way, no matter whether you do it at a hospital or a free testing site, it is free to you. There's no out-of-pocket charge. 20 free testing sites across the state. We have an interactive map up at covid19.colorado.gov. We're planning on opening up additional sites in the future. In addition to that, we're directing testing for asymptomatic folks that work in our nursing homes. With the Colorado National Guard, in partnership with Colorado State University, we're starting with the larger nursing homes and working our way down to prevent asymptomatic workers that might be contagious from going in every day. The caller also asked about antibody tests. Everything I talked about until now are the nasal swab tests, working on the protocols for saliva. A blood test can be used to determine whether you've had the virus. Those are also available generally at hospitals, National Jewish, LabCorp, Quest. And the thing about it is we don't yet know, scientists don't know, the amount of immunity that those antibodies confer. Meaning we don't know if it's like getting the flu shot, which means maybe you're at a 50% reduced rate of getting the flu, or it could be more like a measles shot where you're at a 90% reduced risk. So just because you have those antibodies, because you've had COVID-19 without necessarily knowing it, doesn't mean you should be going out around patients that are contagious with COVID-19. It almost certainly offers an increased level of protection, but that protection is not believed to be in any way, shape, or form perfect by scientists who are studying that.
And as a follow-up to the mass testing, we had viewers wondering about plans for a future vaccination. Would the state help distribute those to Coloradans? Would it be required for school kids?
Oh my goodness, aren't we all looking forward to when scientists can develop a vaccine for this? And if there's any silver lining to this crisis, I think that it will inspire a whole new generation of scientists, of doctors, of researchers to know the difference that they can make from humanity, kids that will be looking up to those who work in labs and those that work in hospitals, hopefully inspire them to do more to help save lives. There are over 100 teams across the world working on the race to a vaccine, including teams at CSU and at Anschutz and at CU. And we know that, and we hope that that'll occur sooner rather than later. And as soon as that occurs, Colorado, along with our country, will look forward to scaling up production and making that as widely available as possible so that we can finally conquer this and once again embrace one another, engage in physical fellowship, and pack the stands at Coors Field and Invesco.
And Governor Polis, we know this pandemic has affected us all in many different ways. Viewer Jean is a psychologist and had this to say about mental health concerns moving forward.
In our society, an attachment of meaningfulness and value that's placed on people who are productive. I've had patients in my practice who end up being unable to work because of some accident, and their sense of self-esteem is significantly diminished because of that. Not that they're less worthwhile, but that they feel less worthwhile.
So what role does the state play in supporting the mental health of its residents as we move forward when obviously life has changed dramatically for a lot of Coloradans?
You know, for anybody who's experiencing extreme anxiety or a mental health issue, please call our Colorado Crisis Services hotline, 1-844-495-8255. This is a public health crisis. It's also an economic crisis, but something that doesn't get enough attention, and it truly is also a mental health and psychological crisis. You know, people by our nature, we want a sense of belonging, we're social, we want to be around others, and it's very difficult to be safer at home, to reduce those social interactions, to forego the things that we really have taken for granted for so long. The light at the end of the tunnel, I know we're all going to appreciate those interactions even more when it's safe to resume them. But in the meantime, don't be afraid to reach out if you're experiencing depression or extreme anxiety.
And what message would you share with Coloradans as we slowly get back on our feet?
We hope to be back on our feet as soon as we can. I think we're already standing up here. And the more carefully and cautiously that we do that, the more we lead by showing justified caution rather than undue fear and anxiety, the better we'll be psychologically, the better we'll be economically, and the better we'll be from a health perspective.
Governor Polis, we want to thank you so much for your time this afternoon.
I want to thank your listeners and your viewers for the thoughtful questions. And you can find out more at covid19.colorado.gov. You can find out more about masks at coloradomaskproject.com. Thank you for staying safe and thank you for being responsible.